Today, we welcome Dr. Edward Tam to the Canadian Liver Foundation's LIVERight Health Forum as the Expert Series. Dr. Tam is a clinical hepatologist in Vancouver, BC, with a focus on viral hepatitis, as well as an interest in autoimmune liver diseases and non-alcoholic fatty liver disease. Fatty liver disease is a growing public health concern in Canada, affecting not only adults but also children. Today's topic is, can I die from fatty liver disease? Please join me in welcoming Dr. Edward Tam.
Well, thank you for joining us, Dr. Tam.
Thanks for having me.
The fatty liver is a growing problem. It is one of the most common causes of cirrhosis in the 21st century and is fast becoming the leading cause of liver transplantation. So, Dr. Tam, our first question is, what is fatty liver disease and what causes it?
Fatty liver disease is really exactly as it sounds. It's a condition where fat infiltrates the cells of the liver itself. And usually we divide it up into two broad categories. Alcohol-related fatty liver disease, where fat in the liver exists when individuals consume significant amounts of alcohol. And then this rising epidemic of non-alcoholic fatty liver disease, where we're seeing fat in the liver and potentially complications of that in the absence of significant alcohol consumption.
And what is the difference between non-alcoholic fatty liver disease and then its counterpart, non-alcoholic steatohepatitis, or NASH?
Yeah, so the terminology can sometimes be a little bit confusing because it's got a lot of different abbreviations, but NAFLD, or non-alcoholic fatty liver disease, is really an umbrella term that refers to anybody who has significant fat in their liver in the absence of significant alcohol consumption. And fat can either exist in the liver on its own, and if it's just fat, then we typically call that simple steatosis, or non-alcoholic fatty liver. But if fat is accompanied by inflammation, then we call that NASH, or non-alcoholic steatohepatitis. And the distinction is important, we believe, because individuals who have fat plus inflammation are at risk of progressive disease, and those are the individuals who over time develop a significant liver disease and may be at risk for long-term complications.
Great, thank you.
You're welcome.
So the next question is it hard to tell if a person has fatty liver disease? Are there any symptoms, and how do you usually diagnose it?
I guess it can be challenging. You can't look at somebody and tell that they have non-alcoholic fatty liver disease. And speaking, as far as gold standard of diagnosis goes, really the gold standard of diagnosing an individual with the condition is doing a liver biopsy. You stick a needle in the liver, you recover a small sample of liver tissue, you look at it under the microscope, and then you diagnose this condition. Functionally, we don't do that too often because patients don't want to have it done, and practitioners understand it's invasive, costly, time-consuming, and inconvenient. So we usually establish this diagnosis using a combination of different types of tests. Of course, history and physical examination, laboratory parameters, imaging. And so it's not that it's necessarily difficult to establish the diagnosis, but it can take some work in order to confidently establish it. Yeah.
Great, thank you. So the next question is, how serious is fatty liver disease, and what could happen to people with this disease, and could you die from it?
Yeah, so the reason we worry or we're concerned about this condition, or we talk about it as a rising epidemic, is that it absolutely can have serious consequences. And it's an interesting situation because right now we understand that in Canada about 25% of people have non-alcoholic fatty liver disease. But within there, of course, we really like to understand who's at risk of really serious or severe liver disease. Who are those people who are going to develop really significant manifestations or complications of liver disease, who may die from fatty liver? And we're still trying to get a better handle of that over time. And the fact is, we don't actually know the answer to that question, but we're seeing more and more of it. You led by indicating that we're seeing fatty liver disease become the #1 indication for liver transplantation. Well, now if we try to look forward into 2025 and 2030, we understand that the number of people who are likely to die from this condition due to advanced liver disease is likely to double in that time span between now and 2030. So it's absolutely a serious concern, and it's the reason why we're trying to address it now and hopefully to change that trajectory.
Thank you. Okay. So next question is, Does fatty liver disease affect men and women differently? Is there a genetic component to it? And can a person who is not overweight have it?
Yeah, so I'll start with the last part because it's maybe the most striking part of this condition. A lot of people assume that to have fatty liver you need to carry extra weight or be overweight, and it's not true. And every day I see individuals of a normal body weight or body mass index and they have fatty liver. And so that helps us understand that although it is true overweight status or obesity is a risk factor for the condition, there's many other things that can play a role, I think, in an individual developing this. And yes, we understand there's a probable genetic component, but we're still in the process of teasing that out and understanding that further. There's definitely other risk factors. You know, we think about things like diabetes, high cholesterol, high blood pressure. And so there's a lot of things that are kind of rolled into this, this condition. At least at this time in the adult population, we don't believe there's a significant difference necessarily between men and women as it is. Yeah.
And just following up on that, is there something that individuals can do to reduce their risk of developing it?
Absolutely. I think, you know, important part of medicine, whether it's liver disease or otherwise, is prevention. And healthy diet, you know, which is typically, you know, calorie controlled. We talk about restricting the intake of refined sugars and carbohydrates are important, and an active lifestyle. You know, these are things that not only treat fatty liver if it's already present, but of course can help prevent it from developing in the first place.
And what about children? Can children have fatty liver disease?
Yeah, unfortunately, this is a condition that stretches across age barriers as well. And, you know, in my work, I'm really only seeing adults, and even in my training, you know, obviously that's where my focus was. But you know, we certainly are seeing individuals with fatty liver in the pediatric population. And actually, one of the most striking things I recall from my training is seeing in pathology rounds discussing liver biopsy samples. Sometimes we would have the opportunity to see adults, of course, as well as pediatric patients. And I recall a case of an 11-year-old with poorly controlled diabetes who had very significant non-alcoholic steatohepatitis under the microscope and significant liver disease related to it. So that kind of stuck in my mind even many years ago, and unfortunately we're seeing more and more of it, not only in the adult population, but in the pediatric population as well.
And do you know if the treatment is similar for kids and adults?
Yeah, I mean, the tricky thing right now is I think the only treatment that we all seem to agree upon or that is evidence-based is control of the underlying risk factors. So if diabetes is present, obviously we like to optimize the control of that. If high cholesterol is there, similarly. And then dietary modification, as I mentioned, weight loss, which is important if an individual in particular is of overweight status. But then reaching forward, we hope to have medications for this condition, whether that's for the adult population, but also the pediatric population in the future.
Okay. So the next question is, does alcohol cause fatty liver disease?
Yeah, absolutely. You know, alcohol is a really, really important and common cause of fatty liver disease as well. And the tricky thing is, if you say look at a sample of liver tissue under the microscope, if you do a liver biopsy in an individual trying to figure out if they have fatty liver from alcohol versus non-alcoholic fatty liver disease, you actually typically can't tell. It causes very similar changes within the liver. So that's why, you know, talking to people, taking a good history is important, and addressing any alcohol piece that might be present. The fact is, a lot of people that I see, they don't purely have non-alcoholic fatty liver disease. Sometimes there could be some background alcohol consumption that we believe is playing a role and that we often like to address as well.
Are there currently any medications to treat fatty liver disease? And if not, how can you reduce the fat that's accumulated in your liver? And will there be new medications coming, and how soon?
Yeah, the medication piece is, I think, and it's an exciting part of liver disease and liver disease research right now. You can kind of think of medications for non-alcoholic fatty liver disease divided into agents or medications that are already out there that we've tried to repurpose to use in fatty liver, and then novel agents that are being developed specifically for fatty liver disease. So of those agents that are already out there, a lot of the things that have been studied in non-alcoholic fatty liver disease have been medications that have been traditionally used for diabetes, say, or supplements like vitamin E. And in general, there are some data to support the use of some of those agents, namely vitamin E and pioglitazone, which is a diabetes medication. But when you look at the studies investigating those agents, the groups of individuals that may benefit, I think, are very specific, and there's a lot of caveats to their use. Pioglitazone, for instance, causes weight gain, and so it seems a little bit unusual to use a medication that can cause weight gain to treat fatty liver disease. Vitamin E is sometimes used, but there are some data to suggest that vitamin E use can be associated with an increased all-cause mortality. So I think the medications that are out there, there's select populations that may benefit from their use, but in general, there's a huge unmet medical need. And so really we're turning to agents in clinical studies, new novel agents that we're trying to investigate to bring to the market, hopefully to specifically address non-alcoholic fatty liver disease. And it's a really exciting area of research. There's a number of molecules in late-stage clinical studies, but nothing that's yet made it to the market. We hope to see that very soon.
Okay, so in like a couple of years?
Well,
10 years?
it's always a bit of a moving goalpost. There was a lot of enthusiasm and thought that the first approved agent may actually come to be approved by regulatory authorities this year, in fact. And it doesn't look like that agent, unfortunately, will be approved on that timeline, but in the near future, for sure. Yeah.
Great. That's definitely exciting. Okay, so this is a question from somebody from the audience. So, I am a 45-year-old who was just diagnosed with fatty liver disease. If I follow a proper diet and exercise, what is my timeline to see results or improvement?
Yeah, so it's a great question, and a question obviously I get a lot from patients that I see, because people want to see the results, and it can be very motivating to actually see some level of improvement when you pursue diet and activity in this condition. So, typically when I counsel my patients about how to get at this condition, the dietary changes are, as I mentioned, it's really about calorie and carbohydrate restriction, and the overall goal, typically, in conjunction with an increased level of activity, is weight loss. And it's interesting because we know that the amount of weight loss seems to correlate with the improvements that you can see in this condition. At lesser degrees of weight loss, you can see a little bit of decrease in the amount of fat in the liver. Beyond that, you can start to see improvements in the amount of inflammation in the liver. And with even more significant weight loss, there are data to support the fact that you can even reverse scar tissue or fibrosis in the liver. And as far as the timeline for that, you can see these changes: improvement in blood work, improvement in the degree of inflammatory activity, and even fat in the liver in 6 months. I think you can see individuals in follow-up and actually start to monitor that. Reversal of fibrosis probably takes a little bit longer if you achieve it, but it's interesting that in a short period of time with significant changes to lifestyle, you can see those changes. And in general, the amount of weight loss you're targeting is maybe a 5 to 10% total body weight loss. Yeah.
Do you have any maybe tangible pearls for the people listening to us out there in terms of what are small things you can start to change in life?
I think the first thing I often start with is people often want to know, well, what is the specific diet that I need to have in order to fix this condition? And I think what I've seen, or in my experience, and even if you look to the data, there's a lot of different diets that are compatible with improving your liver health due to this condition. And I think, one piece of advice that I often have is there's a lot of different ways to eat healthy. And for most people, I try to encourage them not to turn their life upside down, because rarely is that sustainable in the long term. So I think starting slow and doing things that an individual feels is sustainable and that they can kind of, build on is important. So maybe that just starts like not adding sugar to your coffee or something like that, or cutting out full sugar soda, or eating a little bit smaller portion of pasta or bread or another type of starchy carbohydrate, and then just building upon that. I don't think there's one right answer from a dietary perspective.
Okay, and what about from an exercise perspective?
Yeah, I mean, it's interesting. There's been a lot of interest in understanding, is there an optimal type of exercise maybe for this condition? But both aerobic and resistance exercise seem to be beneficial in this condition. And so whether it's going for a brisk walk or, working out with resistance bands or lifting some weights, any activity seems to be beneficial. So my usual comment is just to do anything as often as you can, and hopefully make it fun so it's sustainable. Yeah.
Great, thank you. The next question is there a classification system for fatty liver disease? Some docs say mild, moderate, severe. Others use classifications such as stage 1, 2, and 3. What does all of this mean?
Yeah, again, it can be a little bit of medical jargon and difficulty kind of teasing all of that out. And there's definitely ways to classify severity of disease in fatty liver. Mild, moderate, and severe are often terms that are used to describe the actual amount of fat in the liver, and depending on the practitioner, to try to distill it down and make it more simple from a patient perspective. But I would say of all the things out there, when we talk about disease severity in fatty liver, typically we're talking about fibrosis or scar tissue in the liver. And so when we think about scar tissue in the liver, this is essentially the result or end product of any inflammatory process or any chronic liver disease. And it's really fibrosis that we believe to be very important. So when you hear a word like cirrhosis that we use applied across liver disease states, well, cirrhosis is a specific term that describes a certain pattern and extent of scar tissue or fibrosis in the liver. So if we think about non-alcoholic fatty liver disease and staging, usually when we talk about disease severity, we talk about stages of fibrosis, which starts at 0, being a normal liver, and moving through 1, 2, 3, and stage 4, which would be synonymous with cirrhosis. And so that would be the most common terminology used when trying to make disease severity clear when you're talking about it or referencing it.
Yeah. And then you did mention earlier that for some individuals you can go back a little
Absolutely,
bit of a stage.
yeah, and that's a really neat concept, I think, for practitioners and patients alike. I think the previous thought across chronic liver disease states is that once you have fibrosis in the liver, it's irreversible, and that maybe you could stay or stop the progression, but that you couldn't really fix it. Now we have data across liver disease states, non-alcoholic fatty liver disease included, demonstrating that you can, in fact, reverse fibrosis. And in fact, getting back to the medication piece and the question about future therapies, one of the important endpoints that will be the goal of future therapies is to actually reverse fibrosis in the setting of fatty liver. Yeah.
Great, thank you. So this question is there a link between diabetes and fatty liver disease?
Yeah, so another great question, and there absolutely is a link, and it's a two-way kind of interplay, in fact. So obviously, the diabetes epidemic is a very important one, and there's a lot of potential complications associated with that condition. We also know that individuals with diabetes are much more likely to have non-alcoholic fatty liver disease, and more importantly, more likely to have progressive and more significant or serious non-alcoholic fatty liver disease. The flip side is we also understand that individuals who have non-alcoholic fatty liver disease are at a much increased risk of developing diabetes as well. So there's this two-way interplay between diabetes and fatty liver that I think is becoming of increasing importance, and I think in clinical practice helps highlight those individuals that may benefit from more close and careful monitoring, and also those people who may want to be selected for treatment intervention as early as possible.
And so to follow up on that, what are the effects of blood glucose levels, or are there any suggestions or recommendations? So if a patient has diabetes, what would you as a doctor suggest?
Yeah, so often we see that condition, those two conditions, commonly coexistent, and tight blood sugar control, hitting your diabetes glucose control targets is really, really an important thing. And so anytime I see an individual with non-alcoholic fatty liver disease and poorly controlled diabetes, usually the first step is to control the diabetes, and that may be a combination of medications, of course, in conjunction with the lifestyle modifications that not only will help the fatty liver component, but will also improve the blood glucose as well. Yeah.
Okay. And then I believe this is our last question, actually. What are the effects of fasting on liver health? So out there right now, there's a lot of information, for example, about intermittent fasting.
Yeah.
Is there a link with fatty liver? Is it beneficial?
Yeah, there's obviously different types of diet, time-restricted eating or intermittent fasting. It's been of growing popularity, I think, and it's a question I get a lot from patients as well when they're diagnosed with the condition and they're trying to embark upon a specific dietary plan. They read about it, they have friends who are suggesting it, and I think that in particular for individuals with maybe earlier stage towards moderate stage disease, in my experience, it definitely can be effective weight loss tool, an effective type of diet that can achieve weight loss and oftentimes improvement in non-alcoholic fatty liver disease. I think that when you get to more advanced disease, and in particular individuals with cirrhosis and then decompensated cirrhosis, you really have to be careful about dietary extremes, and fasting is very likely to be not recommended in the decompensated cirrhotic, for instance. And for individuals with more advanced disease, I think it's always important to have that discussion, in the context of your specific situation with your healthcare practitioner. But definitely there are increasing studies looking at intermittent fasting in this condition. I think there's probably a subset of individuals that specifically might benefit. But at this time, I can't say that there's firm data to support, that is the diet of choice, for this condition.
Okay, thank you. And then last question for myself. I've been asking some of our other speakers too. Do you have any resources that you usually refer patients to that are looking to make lifestyle changes, modifications?
Yeah, absolutely. I think that first of all, the Canadian Liver Foundation website is a good kind of capsule for some of the general concepts around this condition, and so I often refer patients to that resource. As far as dietary advice, I find there's a couple of different resources that can be helpful. Here in BC, oftentimes patients might call 811 to get general dietary advice, which can be helpful. Oftentimes, I refer patients specifically to dietitians with experience in the condition as well. But I have to say that I really try to focus on the fact that there's many different ways, I think, to approach this successfully. So in many ways, I like patients to explore and then to come back so we can discuss kind of what they found. And I find that a lot of times people find what works for them, which ends up being the best solution. Yeah.
Great. Well, thank you so much. It was a pleasure to have you here.
Thanks for
you.
having me.